services, as we've just been saying, border closures and health risks are faced by those workers and volunteers. And vulnerable members of the community and groups, including refugee populations, are of most concern as the virus spreads around the world.
Let's now speak to Jennifer Tierney, who is the Executive Director of Médecins Sans Frontières. She joins us via Skype as well. Jennifer, thanks so much for taking the time to speak with us. Now, many of MSF's volunteers and personnel, medical personnel, work in refugee camps or in conflict areas. We know that at best of times, these are areas that have poor access to clean water, poor accommodation, and basically poor access to medical services as well. What are your teams on the ground telling you about the challenges they're facing right now at this time of the pandemic?
So right now we're working in about 40 countries around the world, either to launch COVID-19 responses or to repurpose the programs that you just talked about to be COVID ready. And so we're focused on refugees, the homeless, people who are in healthcare systems that have been decimated by wars, as you mentioned. And one of the most important things that the teams can be doing right now is infection control and prevention. As you said, a lot of the systems in which we're working don't really have the capacity to respond to both war trauma and, for instance, the giant measles outbreak that we're dealing with in DRC, and then add COVID-19 on top of that. So we're doing a lot of different things on the field. For instance, in Bangladesh, we have a hospital in the refugee camp, and we are creating a facility to isolate COVID-19 tested positive patients. We are using our mobile clinics and repurposing those to actually give out infection control and prevention messaging amongst the population. And of course, we're working very hard to try and protect all of our staff with personal protective equipment and the right training on infection control.
Well, of course, MSF volunteers come from right around the world, but there's been these travel restrictions. How are you getting around that?
So the first thing I want to say is how grateful MSF is to all of the staff in the field who are either extending their stay in the field, foregoing their holidays, moving from one country back to their home society to which they've been called, and then taking up work with MSF there. So for right now, we are doing the best that we can to cover the needs. We're going to see a real crunch a few months from now when folks start to get just exhausted and we need to replace them. So we're doing the best that we can to talk to the government about humanitarian exemptions for travel and making sure that we can actually get flights in and out of countries, which is proving as difficult as it is for a lot of folks traveling in and out of Australia.
Now, MSF websites, as I noticed, lists many countries that your organization is working with to try to battle this particular pandemic. Are there certain hotspots that MSF is concerned about?
You know, we're very concerned about a lot of places, frankly. I mean, we are concerned about the Sahel and great swaths of Africa where the healthcare system simply won't be able to cope. And that's why we're working frantically on these infection control measures, because that's going to make the difference at the end of the day to the health systems, you know, in complete collapse versus being able to handle this pandemic.
Now, this global pandemic just goes to highlight that we're only really as strong as the weakest healthcare system there is around the world. Going forward, do you think there will be more of a united or collaborative efforts to try to strengthen healthcare systems in developed worlds?
I mean, there is no doubt that we are asking for that, and we are always asking for that. If you look at the case of Greece, for instance, the refugees living there are currently living in tents where they're sleeping 10 to a tent that's made for 4 people. You know, the overcrowding and the sanitary conditions are terrible. So we're calling on the European government and on Athens to improve the conditions for refugees living in that situation. I think when we start talking about the vaccine, the disparity between developed nations and countries with undeveloped or underdeveloped or damaged healthcare systems who can't afford to pay commercial prices for vaccines on a good day certainly won't be able to afford to pay for a highly expensive COVID-19 vaccine. So we are really advocating that that vaccine be accessible and affordable for everyone, so we don't see the disparity that you're talking about. You know, this pandemic, every single person counts, every patient counts in this pandemic, so we have to be global and in our response.
Jennifer Tierney, the Executive Director of Médecins Sans Frontières, thank you for your time.
Thank you very much.